For those of you that don't know me, my name is Dan. I am one of 5 pharmacists here. I see a few new faces, so welcome. I own this pharmacy with my wife Monica and my father-in-law John. So I've been doing this for 15 years now, quite a while anyways, or at least once around the block I've been. And then sleep is probably the number one question that we get around here, especially with a lot of women. Our pharmacy specializes in bioidentical hormones, and we get a lot of women that can't sleep, and men. But we'll definitely uncover some of the problems that go through with traditional medication. We get a lot of patients that come in through the door that are on sleep aids, so like your Ambiens of the world, your clonazepams, your benzodiazepines, and those could be good for a short period of time, but eventually they disrupt our sleep, and we'll kind of walk through some of that. So how do we get off of those medications, and what are the, some safe natural alternatives that we can do instead? So that's kind of the journey that we're going to be on tonight. So I've got only about 45 minutes to an hour worth of material. I'm going to try to hold questions to the end, just so I don't get too far off track. A lot of times anyways, I end up answering a question in the next slide or two. So we'll try to do that as best we can. This is my medical disclaimer. So as a pharmacist, I can't stop your Ambien tonight and tell you to take something else. Nor can I help, I can help you titrate it down with the permission of your doctor. So at the end of tonight, if you're on a medication that you're using for sleep and you're like, this is, you need to get off of this, or you want to get off of it, I can certainly help with that. We have dozens of patients right now currently that we're making everything from capsule titrations to liquid suspensions, and slowly getting patients off of these medications, because they disrupt our normal sleep patterns. We all probably intuitively all know that. And so it's important to slowly taper off of that. One quick story I'll share is we have a patient that's on Cymbalta, which is more of an antidepressant, but she was using it for sleep. And if you know that drug, it has hundreds of little beads inside of the capsule. And we are literally counting down the beads every couple of weeks for her. She has been on like a 6-month taper. It's been excruciating for her, because when you get physically addicted to a lot of these medications that are out there, obviously our bodies become dependent on it, and we don't want to pull the rug out from underneath her feet. We're slowly tapering her down. Now each patient, there's a variance there, but sometimes we can get stuck on medication and have to slowly go down on that so we don't get rebound insomnia. So that's what all this says. So don't stop your sleeping medication tonight. So just overview of objectives. So we're going to go through the health benefits of sleep. A lot of this stuff is going to be stuff we already know, so that can be earth-shattering there. Reviewing health consequences of sleep deprivation. Some new things we'll probably learn about that tonight. That's kind of some scary information there. Non-pharmacological approaches to sleep. Again, we're going to review a lot of these things that we already know, like shut the lights off in the room, that kind of thing, right? We're going to go through importance of melatonin. There is a lot of benefit to having melatonin on board in the right amount. So we'll spend a little bit of time on melatonin. It's been around forever, but there's a lot of good studies on it. And then cortisol management. We'll talk a lot about cortisol. Oh, come on in. There's a couple of chairs up there. And so we'll spend a fair amount of time there as well on cortisol. Like, what is cortisol? Why is it being overproduced? Why is it disrupting my sleep in the first place? So we'll go through that. And then, if we've tried all of those non-pharmacological approaches to sleep and we're still not doing well, I've got a few examples that I pulled here that we'll talk about tonight. So, okay, if Ambien's not for me, and I'm doing all of these sleep hygiene things, what else can I possibly take? So we'll go through some of the supplements that I encourage patients to take if they're still struggling. So that's the journey we're going to be on for the next, like I said, about 45 minutes to an hour, and then we'll open it up for questions. So some of these things we already know. There's a lot of people out there suffering with insomnia, and the combat then there's a Starbucks probably on every corner now, right, or some kind of coffee shop, and 90% of us, I'd even say, use, or even more than that, use caffeine to help us with our poor night's sleep the day before. And there's a vital connection between hormones and sleep quality. So as our sleep quality goes down, our hormones tank as well too. So that's where a lot of these patients that are coming into our pharmacy, they already have hormone imbalance and they say they have sleep issues. Well, it's a vicious cycle too. Their hormones become more unstable and they're less able to sleep, and then just on, and then you can't sleep well, so then your body can't make hormones, and so on and so forth. We keep going down that slippery slope. So we'll spend a little bit more time on that too. So why do we sleep, right? Get the obvious stuff out of the way. So, you know, it solidifies and consolidates memory, helps us with learning. We all know that. Restores and rejuvenate. I always tell patients it's that rest and repair process of the day. We got to make sure we understand that. Helps us to grow muscles. You know, just build tissue. Synthesize hormones. I touched on that. And then detoxify the body. That's when the liver and the lymphatic tissue wake up, and you know, our whole body goes on this detox flushing process at night. And if we're not doing that, we're not going to be well the next day and the next week and so on. That's where we'll get into all the diseases and complications. We're not cleansing our body at night. So yeah, we're asleep, but our bodies are awake, right? Our detox pathways are, you know, in full force at that time. So sometimes there could be hiccups with our liver, with our lymphatic tissue not working the way that it needs to. So we'll get into some processes that go through and address that issue. These are things, again, you know, benefits of a good night's sleep. Increased energy, we know that. Concentration's improved. Better learning ability. Make healthier food choices. I know when I don't sleep, the next day I'm not doing well on what I'm eating. Reducing the risk of chronic disease and type 2 diabetes. I was at a seminar in Chicago in April that talked about, we're learning more and more about melatonin and clock genes and circadian rhythms and so forth. Every tissue in our body, every organ in our body has a gene in it that runs on a specific clock. So talking about things about when do we stop eating at the end of the day, when do we start eating at the new day. A lot of that science is still trying to be developed. So Dr. Chatterjee, he's I believe in England, wrote a fantastic book about circadian rhythm and you know, sleep cycles and awake cycles, and again, when do we stop eating during the day and when do we start eating in the morning and so forth. So we're not going to get into all of that tonight. That's a whole 4-hour class. Better memory, increased life expectancy, that's a good one. You know, reduce risk of being overweight. So there's a couple things just with that alone. When our bodies are sleeping, we're building more muscle, which that in turn helps burn up more calories. And also with that, we burn a lot of fat at night. The better we sleep, the less we weigh in the morning. So that's a good thing. Reduce stress levels. So again, we'll talk more about cortisol quite a bit tonight. We want to get our cortisol levels in an appropriate range. They want to rise in the morning, but at the end of the day, they want to be close to zero. So we'll touch on that too. Reduce the risk of developing Alzheimer's. So there's a lot with memory, so in our brain function. So the better we sleep, the less likely we have of chronic CNS development. So I'm going to have a lot of kid pictures in tonight's talk. I don't even know which kid of that is mine. I have 4 of them, and I think that's Luke. I think that's my third. Anyways, I have a lot of pictures of my kids sleeping. They sleep so well, especially at that age, right? Talk about tissue rebuilding and so forth. So we need biological downtime. I think in today's society, we all have this idea of just running, go, get as much done. But it's just as essential as food for survival. We need to cut off that day and then go on to the next. So that's important to just put in our minds. Sleep heals. So we know this when we're sick. We need more sleep. Just last night, my daughter had 101 fever. As soon as she came home from school at 3 o'clock, she jumped into bed, got up for dinner for about 30 minutes, went back to bed. My wife, Monica, took her temperature. It was still 101. I got home last night. I saw her for 5-10 minutes. What was that? Maybe 7:30, 8 o'clock. She went right to bed, and in the morning, her fever was gone. We thought she was going to be out for at least a couple days. After we're done recording, I'll tell you the protocol I gave her, but it's a little bit off topic, but the immune system needs our body to sleep. And again, part of that is that whole detox process as well too. So that's important. And again, intuitively, I think we all know that. Sleep makes us burn fat. Yay for that. Sleep makes us smarter. It restores. It reboots. So we all know these things. I think that's Luke. I think so. I threw a couple myths in here. So the older I get, the less sleep I need. Completely not true. I would argue that we need more sleep. Maybe not when we're that age of, a year, 2, 3 years old, when we're getting 10 to 14 hours a day. But getting 5 hours of sleep definitely is not enough. I mean, there are studies upon studies that show if we get less sleep, the higher risk we are for Alzheimer's, dementia, memory loss, those types of things. We're at higher risk for type 2 diabetes. There's actually a study done, I'll get a little bit off topic here, but with Dr. Chatterjee in the seminar in Chicago. Come on in. There was a study that was done on patients that were all overweight, that had a BMI above 25, and it was more of a subjective study. Patients reporting how much sleep they were getting. And actually the patients that got less sleep, same BMI, they had a higher risk for type 2 diabetes. So really, type 2 diabetes doesn't necessarily, just because you're overweight, you're going to get diabetes. It also matters of how well you're sleeping and detoxing and so forth and cleansing your body. Just because as we age, we need less sleep, that's certainly not true. Lack of sleep consequences. This is not an exhaustive list, but 4 out of 5 patients suffer from sleep deprivation prior to being diagnosed with depression. That's a huge number. They're definitely not making enough serotonin and melatonin, I'm sure. Overeating, obesity, type 2 diabetes, premature aging. I think, again, a part of that is we're not cleansing and detoxing if we're not getting a good night's sleep. So, talked about our immune systems already. We're at a higher risk for getting infections, stress-related illnesses. So going back to cortisol, cortisol is neurotoxic. When our cortisol level goes up, or when our stress level goes up, our cortisol level goes up. When we're stressed, our body's not thinking about producing white blood cells, so our immune system is on the back burner. So that's important to know. And then we have a weakened immune system, that's the same thing. And then we're higher risk for disease and stroke. So there's a lot of chronic illness related to sleep deprivation that we may not we fully don't understand some of these mechanisms quite yet, but we know that they're out there. So how well rested you are and how well you function depend not just on the amount of time you sleep, but whether or not you're getting through distinct stages of sleep cycles throughout the night in predictable patterns. So we want to make sure we're getting into that deep REM sleep as well. I'm going to skip over this slide. I have a better depiction of this, but I have one of these, this is a little antiquated, but one of these Fitbits that still tracks my sleep cycle. If you don't have one of these and you're suffering with sleep issues, I think this is a nice tool to have. I could actually tell, so it gives you a sleep score in the morning. It goes through all these different cycles. Don't tell me, I don't know how the technology works, how it knows all of this. So some of this can be questionable. But it's telling me, like, when I went to bed last night around 11 o'clock, I fell into deep sleep, and then I woke up at whatever time that would have been, maybe midnight, woke up again for a short period of time, maybe about an hour later, got back into deep sleep here, and then just went into some REM sleep during the early part of the day this morning. So it's nice to look at that thing and have a picture of it, and that's gauging your treatment of what you're doing as far as maybe supplements or medication and so forth. So I really do like this. Not that this is the be-all, end-all, but it is a nice tool that I have. And I could see subtle differences when I have a sleep score of, so this was Monday, so Sunday into Monday morning, I had a sleep score of 81. However, I actually felt better this morning when I woke up with a sleep score of 73. I don't know exactly why that is. I didn't do anything different from Sunday or to Monday that I could tell, but then it just keeps giving you all these different scores. So it's kind of a nice little fun tool to have, to look at. I will say we have a 10-month-old still in our room that wakes up about every 3 hours, 4 hours, and my wife's sleep score is like 50. It's awful. So a lot of times I'm sleeping through some of these things when she's getting up to nurse her. So I can't wait till she moves out of our room, but and more so for my wife. So I don't even want to show you her sleep scores. They're horrendous. Sometimes she doesn't even score a number because she's gotten up so many times during the night. Awful. That's why women are more prone to Alzheimer's and dementia. There's a correlation there because they're getting up and feeding baby and so forth. So we got to get Monica back into sleeping better once these kiddos sleep on their own here without snacking during the night. 65% of U.S. adults are losing sleep due to stress. So that's another. We're going to spend some more time on cortisol in a few more slides, but I'd even say that number is even probably higher. If I'm not tired in the morning, unless I've gotten a good enough sleep, certainly I don't believe that for 1 minute. I even, during the day, then I feel, I got a good night's sleep, and 4 hours later, I'm just dragging. So a lot of it has to do with hormonal balance as well. Things that rob us of good sleep. So again, in our pharmacy here, a lot of patients going through menopause, hot flashes, night sweats, waking them up in the middle of the night. They're drenched. The sheets are totally soaked. A lot of those patients are just low on progesterone. We'll talk a little bit more about progesterone in a little bit here too. But progesterone not only helps us sleep, it helps improve our Gaba response. It helps balance Gaba and glutamate. So that's important to get those hormones balanced appropriately. Obesity can be related to sleep apnea as well too. Won't get too much into that. Shift work, stimulants, and then blue light. A lot of the screen issues. So we'll talk about putting your cell phone away, getting rid of all of these screens at least 1, 2, 3 hours before you're going to bed. We want to make sure we're not looking at our cell phones, all the way up till we're going to sleep. And I just put this slide in here. I thought this was interesting. So pharmaceuticals that can cause sleep disruption. Some of these things we might not even think of that we're taking in our medication that are good for us, that are helping with an issue, but that could be a problem. So at our pharmacy, we do a lot of thyroid medication. So that in turn can be a stimulant that's keeping us up. So we got to be aware of what time of day are we taking our thyroid medication. Should we be taking it in the morning? Should we be taking it at night? There's not a clear-cut answer on that. Most patients are going to take their thyroid medication in the morning, but there is actually some advantages of taking it at night as well. So that's more of an individual thing that we should look at. Oral contraceptives, beta blockers is another thing. Last week we talked about CBD and THC, so those types of drugs can cause sleep disruption. Alcohol, as we know, a lot of times we might use alcohol to relax at night. I certainly do that. But I will tell you, when I do have a drink or two, or maybe even more than that, I do not have a good sleep score the next day at all. I may fall asleep really well, and I wake up in the morning, and I've definitely been there. I'll speak for myself. That it's like, wow, that didn't work so well. Why did I do that? Coffee, another one of my vices, and I'm sometimes, if you've been to one of my seminars, I'm drinking coffee while I'm doing my seminar at night, just trying to go. But again, we don't sleep as well. It's disrupting our sleep cycle. And then DHEA, so that's a hormone that we actually compound quite a bit here. So not to be confused with the fish oil DHA, but DHEA. It's a good anti-aging hormone. But that should be actually taken in the morning. That can disrupt our sleep cycle if we're taking that at night. Or it's actually sold over the counter as well as a 5 milligram and a 25 milligram capsule. So if you're on DHEA, that's something we might want to consider taking in the morning instead of at night. So here's another one of my kids sleeping. Yeah, so that's Luke. I can identify that. And I believe that's Grace. And they fell asleep in the back of the car going somewhere. But it's amazing when we're kids how well we can sleep like that. And they don't have to worry about any of these sleep hygiene things about, they just fall asleep. But we should have, a cool temperature in the room that we're sleeping in. I can't stress enough, Dr. Chatterjee goes through this quite extensively in his book about having the room absolutely 100% dark, like switching out your alarm clock to an old-fashioned alarm clock, no screen on the alarm clock, blackout shades, absolutely zero light whatsoever. That is critically important. So dark room. We want to shut, even when our eyes are closed, doesn't matter. The light will still get through and stimulate the brain thinking that it's awake essentially. We talked about the screens already, the no laptops, the TVs, the phones, and so forth. If you need to use white noise or a fan, that's okay. You can have those things on. Just make sure they're not too disruptive for you. The right mattress, pillow, some of these things are self-explanatory. Loose-fitting clothing or no clothes. We just want to be obviously as comfortable as we can. Make sure the room is right. This is Lily. So she uses a sleep mask, which is kind of cute. She looks pretty comfortable there. She was the one that was sick last night. She sleeps really, really well. So that's good. Deep sleep prep. So we want to get in, going back to the slide with the screenshots of my Fitbit. We want to make sure we're getting to that restorative sleep, really detoxing and cleansing the body at that time. But no alcohol 1 to 2 hours beforehand, no nicotine, no exercise. I mean, stretching, yoga, that kind of stuff is okay. No caffeine, at least 3 hours prior to going to bed. I would say none after 12 p.m. is even better. No blue light, again, no screens, no sweets, no chocolates, no scary, what I put in here, scary movies, bad news, angry words. So anything that's going to increase our cortisol, don't watch the 10 o'clock news at night if it gets you going. That's just going to raise your cortisol, and that is going to screw up our sleep cycle. So some things that we want to do, so in the morning, get that sunlight. There was a study done, I wouldn't say really call it a study, but observational information that Dr. Chatterjee talks about in his book, where they have 2 sets of patients. They're all smokers, but one set of them goes out and they walk their dogs in the morning. Those patients had a less risk of cancer because they got up and the assumption is they were up in the morning, first thing, got the sunlight, and that improved their health. All of them were smokers, but the half that got up and walked their dog had less risk of cancer. Start smoking, but buy a dog and walk that dog in the morning. Yeah. There's definitely more to work out in that study, but meditate, pray, eating a protein snack before bed. If you're really hungry, get something that's got some tryptophan in it. So turkey, fish, nuts, spinach, those are all good melatonin precursors. Those are all something easy things that we could do. Dim the lights in the house. I am an electrician, what do I call amateur electrician, I'll put it that way, where I got all the houses, or all the rooms in the house now have dimmer switches on them, so I always like getting the whole house set where the lights are nice and dim. And then emptying your mind. So if there's a lot of patients that come here to the pharmacy, they're just complaining that their mind is continually racing and so forth. They just are worrying about this and worrying about that. So if you got to write things down, have a notepad at the side of your bed, certainly do that so that we can clear our minds. We don't want all that stuff kind of keeping us up and worrying about things. Who do I have here? This is Lily again, which I don't think she was sleeping there. I think she saw me come in and put her sunglasses on, and that's my oldest, Grace. Totally zonked out, and that was in the middle of the day. With sleep apnea, if that's an issue for you, helping to lose weight is going to help. A CPAP mask will certainly help with that, of course. A lot of patients grind their teeth at night. So if that's an issue, one little trick to try, doesn't always work, but 100 milligrams of B2, of riboflavin, just B2, can sometimes help with that. If you suffer with restless leg syndrome, a lot of patients will come into the pharmacy and they'll be on, I don't even know the name of the drug anymore, ropinirole? Forget the name, I think it's ropinirole. I can't think of the generic name for it now, to help with restless leg syndrome. A lot of those patients, I actually recommend putting them on magnesium and potassium, and they come back and lo and behold, their restless leg syndrome issue is completely gone. Doesn't work all the time, but I've had a lot of patients come in and do that. So I'll put them on, magnesium. I don't normally start them with iron unless I know their iron is actually low. Stretching, yoga, that kind of thing will certainly help with restless leg syndrome. So still kind of cheap. So solving the insomnia riddle without taking into account hormones is like trying to get a good night's sleep with all the lights on in the room. So we have to figure out if a patient has insomnia, they're on Ambien or some kind of other sleep aid, we've got to look at the hormone picture, especially cortisol, especially progesterone for women. If those numbers are off, it is going to be very, very difficult to get that patient to sleep well. And they're not even sleeping well, so they're not even making hormones that they should. So that's where that vicious cycle starts. Naps are a waste of time. So I will tell you that they're not a waste of time. I'm a big fan of naps. I take them myself. Now it's like, oh, then you're not going to sleep well at night and so on and so forth. Well, we got to listen to our bodies as well too. And so if we need to sleep and we need to rest for a short period of time during the day, go for it. But if we're taking a nap for 3-4 hours in the day, well, that might not be so good, and we're doing that every day. But those quick cat naps during the day, 15 minutes, maybe if it's even 30 minutes, that's fine. Go for it. That makes you feel better. Absolutely do that. Hormone testing. So if you've stopped the coffee, you've tried some maybe natural sleep aids, some melatonin, some valerian root over the counter, relaxation exercises, all that kind of thing, you still can't fall asleep. Again, let's get the cortisol test done, and let's do a progesterone test as well. So to help identify sleep disorders, we've got to find out what our cortisol and melatonin is doing in the body. I think I have a picture of this test. So ZRT, one of the saliva test companies that's out in Portland, Oregon, that we teamed up with, they do just that. They do a 4-point cortisol test and a melatonin test. And we can actually measure a patient's melatonin throughout the night by actually collecting their urine in the morning. And there's a metabolite, a melatonin metabolite that we measure. And we can find out how much melatonin was produced the night before. And this is very informative, because if that's truly the issue that's going on, we're going to dose that patient with a proper amount of melatonin. Retest them in 3 months typically is what I recommend doing, and testing their cortisol again, making sure that their cortisol is suppressed during the night and that their melatonin is increased. So that's the cost of that test. I don't have it off the top of my head, but it's not cheap. It's probably around, I want to say $250 to $300. So it's definitely not a cheap test. But if somebody has tried so many other things and they're still not sleeping, I'm going to recommend this test for them. So it's cortisol and melatonin. So melatonin, I'll spend a little time on melatonin. I do still think it's a very good natural sleep aid. It's also an antioxidant. It's synthesized from tryptophan, not that that's terribly important. But again, you can find tryptophan, amino acid in the turkey, fish, spinach, nuts. There's a lot of cofactors that do go into our body producing our own melatonin. The biggest thing I tell patients, though, is take B6 is one of the key factors in helping our bodies produce more melatonin. I think I got a diagram of the biosynthesis. So actually, when you get into tryptophan and 5-HTP, 5-hydroxytryptophan, you need vitamin B6 in a multitude of different biochemical reactions to get all types of different neurotransmitters and hormones in the body. So here's where serotonin comes in. So if that patient that's depressed and can't sleep, I'm going to load them up with 5-HTP and vitamin B6 to help them with their depression and their sleep. So that's, always think of B6 if you're not able to sleep well. Melatonin, we know works for the brain. It's going to help us with sleep, of course. There's actually some GI issues that melatonin is actually beneficial with, and it does help to repair the adrenal glands as well. So melatonin does a lot more than just helping us fall asleep. There's other target tissues that it's important in. This is Luke again. I don't even know where that's at, but it's amazing where kids can fall asleep. So melatonin rhythm, this is what Dr. Chatterjee talked a lot about in Chicago, but it's that production set by light and dark. I can't overstress the importance of having the room absolutely dark when we're sleeping. So the shades, get the blackout shades, whatever it takes to get, you want zero light in the room. Largest production of melatonin is between 11 and 3 o'clock in the morning. If you're waking up during that time, Usually I tell patients, especially I would even pull this back to about 1 o'clock to 3 o'clock in the morning is when your liver and your lymphatic tissue are on high speed, and a lot of times you have to detox and cleanse your body if you're waking up between 1 and 3. We'll talk about detox in a minute. But then you're totally disrupting your production of melatonin, and it's so hard for those patients to get back to sleep because now they wreck their melatonin production and they've got this detox problem that they've got to deal with, or this liver issue. Kind of a double whammy when you wake up between 1 and 3. And I'm assuming that you have you're a first shifter, you have a quote unquote normal sleep cycle. You go to bed at 10, wake up at 6 kind of a time. Melatonin, okay, we know about the helps with sleep. It also works as a vasodilator in the cardiovascular system, so our blood pressure is actually lowered because of melatonin. Decreases body temperature, works as a great anti-inflammatory. If you ever heard Dr. Whitcomb speak here, I can't remember which talk it was. I think it was the Dale Bredesen talk that he did a year or two ago, but melatonin at high doses, 20, 30 milligrams, it's very neuroprotective, it works as much as like an anti-inflammatory agent. So melatonin at higher dosing can actually be very protective to the brain. For sleep though, for just talking sleep, you don't need a lot, typically. 0.3 to up to 3 milligrams. We sell a lot of this ReadySorb spray, which is a nice liposomal spray. It's a half of a milligram per spray. 1 or 2 of those sprays under the tongue, 30 minutes before bed can be very beneficial. There is a range with melatonin. I will say I do get a lot, even though I like melatonin quite a bit, I have a lot of patients that come back and say it didn't work. So it could be a dosing issue, it could be the route issue, it could be a timing issue. So it doesn't need to be sublingual for that patient. Does it need to be an hour before they go to bed or 4 hours before they go to bed? Or does it need to, there's a slow release melatonin. So there's a lot of things with melatonin that we don't have quite pinpoint yet. So if a patient comes in and says, yeah, the melatonin didn't work, I'm going to ask you all those questions. How did you take it? Was it you just swallow a capsule? Did you use the spray? We don't carry the slow release product. We order it in as needed, but maybe that patient needs an immediate release to get them to sleep, and then the slow release to get them through the night. There's all these different things. And so melatonin does get tricky, but it is important, especially if we've done the test to figure out how much they're going to need. And then here's the other thing too: time to benefit. Some patients will feel benefits with melatonin that first night, and then you have another patient it's going to take them up to 3 months potentially. So who's going to try something for 3 months without any success? Like, yeah, I'll try. We'd give up on it. We'd all give up on that. But if it's truly an issue and we measure your level, that might be more convincing that, yeah, I need to keep taking my melatonin. With melatonin, morning sedation, so if you do take too much, it could be a problem in the morning for some patients. Vivid dreams may decrease seizure thresholds, so that's important, especially in children. And then hypothermia, and this is theoretically, so melatonin causes vasodilation. You can lose too much heat, you can potentially get too cold. That's more theory, but. Patients that can benefit from melatonin, so high stress, anyone with high cortisol levels. Talked about melatonin being anti-inflammatory and neuroprotective, so it can help with cancer. So you kind of get those two for one deals. So thyroid disorders, morning fatigue, shift workers especially, diabetic patients having issues with blood sugar control. Actually, melatonin can help because they're actually going to be. It's in direct correlation here, but what's happening is they're able to sleep better, they're able to burn more fat during the night, gain more muscle tissue. The more muscle tissue a patient has, the better they're able to control their blood sugars. Of course, I'm going to switch gears now. That was melatonin. So cortisol management, this is where we get into stress. How stressed is the patient? Conditions associated with cortisol dysfunction, there is a lot on here. So depression, anxiety, talked about that a little bit, chronic fatigue, insomnia. If you have a high cortisol level, you're not going to sleep well. We'll talk about that. And fibromyalgia. If you have high cortisol, you don't sleep well, you don't cleanse well, you get a lot of chronic whole body inflammation that could turn into fibromyalgia. Talked about the insulin resistance and diabetes connection. cardiovascular disease, obesity, IBS. There's a lot of things here. Infertility. The more cortisol you have in your blood, in your body day to day, the weaker your bones become. Autoimmune conditions creep up. Well, how is that? So if you give a high cortisol level throughout the day or throughout the night for that matter, your immune system is on the back burner. So if a patient is stressed, their immune system is not where it should be. So I see that quite often here. We have so many patients with autoimmune disease, Hashimoto's, RA, so on and so forth, and you measure their cortisol and it's way too high. PMS, one thing there that's going on with that connection, patients' cortisol levels high, they don't sleep well at night, they're not making enough hormones, they're not making enough progesterone. Give a patient some natural progesterone, put it on their cycle, and lo and behold, that goes away. Talked a little bit about hot flashes already, but some patients come in, they're already on progesterone. So I have a lot of patients that stop in, their doctor gave them the progesterone cream or they gave them the progesterone capsules, and they're still getting hot flashes. Oh, how can that be? I thought, or I'm taking my estrogen patch or my estrogen cream that you gave me, and I'm still getting hot flashes. Well, how stressed are you? Well, I'm at a 12 out of 10, my stress is through the roof. I'm like, well, it's not your hormones that are unbalanced that's causing your hot flashes, it's your cortisol. So we gotta think of it that way sometimes. Poor memory, so cortisol shrinks the brain. I was at another seminar, I can't remember now, a year ago in Chicago, and they were actually showing us pictures, MRIs of patients' brains with high cortisol levels, and their brain was actually shrinking, which is very scary. So you get into a lot of these neurodegenerative diseases with high cortisol levels. And then hypothyroidism. What's going on there in that picture with that patient is when there's an enzyme, mainly in the liver, 60% of our thyroid is converted from T4 into T3, so inactive to active hormone. And what's happening is cortisol blocks the enzyme that converts the conversion from inactive to active. So as our cortisol and stress level goes up, our conversion goes down. So sometimes you can just fix a patient's hypothyroidism without giving them medication, but fixing their stress response. So supporting the HPA axis, so there's a lot of things we can do for our adrenal glands that are producing this hormone. So sleep hygiene, we talked about that, getting moderate levels of exercise, getting B6, magnesium. I'm a huge fan of B6 and 5-HTP. So 5-HTP, 5-hydroxytryptophan, I think I've got that somewhere right behind me actually. I can never locate it, well, whatever, it's here somewhere. And then Adrenal Builders. So with Adrenal Builders, it gets a little tricky. So you want to be able to build up and have a normal response of cortisol in the morning, but right around 6 o'clock, you want your cortisol levels to drop. And so then sometimes that patient that you're building up their cortisol during the day, you actually want to bring it back down at night. So there's things like adrenal complex or like licorice root. Licorice root prevents our body from breaking down cortisol. So we want to give somebody licorice root in the morning, but then at the end of the day, say around 6 o'clock, 5 o'clock in the afternoon, I want to do something to get rid of that licorice. I want to do something like phosphatidylserine that'll block and start blunting that cortisol response. So adrenal builders are good for that patient that's so fatigued during the day, but we don't want to rev that patient up to the point where then they can't fall asleep at night. So we got to be careful with adrenal builders and how we put those into our schedule. So lowering bedtime cortisol. So when our cortisol level naturally goes up in the morning, it usually rises about an hour before we actually wake up. Again, as the day goes on, though, that cortisol level almost drops to zero. You can barely measure it at the end of the day, and that's what you want to see when you do a cortisol test. If somebody's cortisol is still elevated, again, around 5, 6, 7 o'clock, 8 o'clock at night, this is where these 4 products come in. So there's ashwagandha, which is an adaptogenic herb, something easy to take. L-theanine, which is down here somewhere. I'm a huge fan of L-theanine because you can use it throughout the whole day too. If somebody's adrenals are burnt out, they're under a huge amount of stress, they're drinking a lot of coffee, This will actually take the edginess off of the caffeine, which is nice during the day, but it also helps that same patient sleep and get their cortisol down at night. So that's a product that they can, it's a liquid, just put it under your tongue, hold it there for a couple of minutes and swallow it. You can do that, have that patient take it throughout the day if they're kind of that wired and tired patient, but then you can also have them take it at night to help them sleep. Phosphatidylserine is a neat product. I think I pulled that as well. Maybe not. This guy here. We learned about this in Chicago a couple years ago. So phosphatidylserine is neat because it actually blocks the receptor that cortisol is stimulating in the brain. So if a patient has high cortisol at night and they just can't, if that's the patient where their mind is just racing over and over and over again, I'm going to give them phosphatidylserine, and that's going to stop the cortisol from stimulating the brain at night. Doesn't work perfectly, but that's the mechanism that it's working under. I have a patient right now that started out at 100 milligrams at night, and now she's up to 400 milligrams at night, and still her brain is just won't shut off. So then a lot of times I'll give her some Gaba. She's probably got a lot of glutamate in her system, which is her excitatory neurotransmitter, so I'm giving her Gaba and 5-HTP to help bump up her inhibitory neurotransmitters, and then still have the phosphatidylserine on board. And then chelated magnesium. So chelated magnesium is a fancy word for reacted magnesium. Reacted magnesium is just essentially the mineral, the magnesium. It's attached to an amino acid, and the body thinks of it more as a food source of magnesium, so it's better absorbed. That's all that means. So reacted magnesium or chelated magnesium is really the better way to go versus what you typically see out in the market is magnesium oxide. Magnesium oxide is cheap, but it's very poorly absorbed. So a patient will come in and say, oh yeah, I'm already taking magnesium, but I'm still having problems with sleep. This is usually my first go-to product is reacted magnesium. Magnesium is good for 200-300 biochemical reactions in the body. One of them is relaxation and helping with sleep. So most of us are magnesium deficient anyways. It's going to help with a million other things in the body. So I always start with magnesium. Plus it's relatively cheap, all things considered. You can buy a bottle of magnesium for $30-40, where phosphatidylserine is super expensive. This bottle right here is $82. Crazy expensive. And that lady's taking 4 of these a day, just burning through it. So that's definitely not my first choice just because it's so cost prohibitive. L-theanine's cheap, and so is ashwagandha. Kind of switching gears a little bit here, or going back to cortisol testing, but we want to find roadblocks that are resetting our circadian rhythm. So if there's something that's going on that's, again, not allowing us to have a natural sleep and wake cycle, we got to figure out what that is. Doing a 4-point cortisol test, it's what they call precise diagnosis versus guessing. So a lot of patients come in, they don't want to spend the $200-300 on the test. And I could guess wrong, and then I'll put you on Adrenal Builders, and maybe you don't need that. Maybe you need the opposite. You don't need, your adrenals are fine. We need to suppress the cortisol at night. So that's important. And then it really has better outcomes. So if you have been struggling, if you, again, have taken a lot of these supplements I already talked about tonight, I know this test, if you skip the melatonin, because that's where it really adds on cost and testing, but if you just do what's called a 4-point salivary cortisol, it's $160. It's a little more reasonable. We can still glean a lot of good information out of just doing cortisol testing. And we can leave the melatonin for another day. There is a product that covers a lot of this. So there's a product called Serenity Pm, which increases Gaba, which is our inhibitory neurotransmitter, which is a good thing. Increases melatonin production, decreases time needed to fall asleep. It has a little bit of that phosphatidylserine in there that I talked about, so it reduces the negative impact of cortisol at night. Produces REM, prolongs REM sleep. It's got a little magnesium to reduce muscle tension. I just put the quick dosing instructions. So if somebody comes in, they don't know what they should be on. They've tried maybe melatonin before. Maybe they're under a fair amount of stress and so forth. Usually I tell them, well, here, this is kind of the shotgun approach. Just try this product. It's got a lot of everything in it, and a lot of patients will succeed with that. Sometimes they don't. Sometimes we got to even give them more melatonin on top of that. But this is this product here covers so many bases with one thing. So if you're not sure, well, which patient am I? Where do I fall into which category? This would be the one for you to try. Oh, my clicker stopped. Oh, there we go. Other sleep support supplementation. Talked about progesterone already. Actually, men can use progesterone, believe it or not. I mean, this is one thing I haven't guinea pigged for myself yet. Maybe one day I'll do it. But you could give your husband 100 milligrams of your progesterone capsule, and they'll probably sleep like a baby. It might take a few doses, but then it'll lower their testosterone. But anyways, they'll sleep fine. Talked about Gaba a little bit, the calming neurotransmitters. You can actually buy Gaba right off the shelf, just like this, and then combine it with some B6. It can be very helpful. If your mind's racing at night, I like using Gaba. You can even use it if you're very anxious, if you're on medication for anxiety. A lot of times you can use some Gaba to help calm down your anxiety. Tryptophan, 5-HTP, I talked about that already. B vitamins, again, mainly B6. Only take those in the morning. A lot of B vitamins can be stimulating, especially B12. Here's where I talk about detox supplements. So milk thistle. So if you're the patient that wakes up between 1 and 3 o'clock in the morning, you can't. Well, even if you can or can't fall back asleep, a lot of times you can't fall back asleep right away. That to me signifies that you've got a congested liver, or your lymphatic tissue is just clogged. And so milk thistle, 100 milligrams 3 times during the day will actually help you sleep better at night. So I've had quite a bit of success with just milk thistle. Calcium, magnesium at night, talked about those already. Omega-3s to some level, so your fish oils are very neuroprotective. Valerian root to some extent. I don't have a lot of success with, or I should say success, but a lot of experience with valerian root. But it can be helpful in some cases. And then just getting everything back into sync. So setting up an evening ritual is important. Decide, you want to try to get that 7 to 8 hours of sleep. And go from there. And then surrender to sleep. Just let go of the day that you've had, and focus on the next day when it gets there. Is important too. Sometimes easier said than done, especially for that worrying type personality. So, and that's Luke again. It's hard to see on this, but I was actually running on the treadmill in the basement when he just totally zonked out, which is just amazing. So, and then there's another one of my kiddos. That's my last one. I know that because we just had that. That's Joy, and she was only like, oh my gosh, 2 weeks old when that picture was taken. But so the photographer told us to keep her up and not have her nap, so that she'd fall asleep for that picture. So, yeah. So, cute stuff. All right. I think that's my last slide. Yep. How'd I do? That was about 50 minutes. I ran through that pretty quick. Questions?